Not only are gynae nurses often being accused of negligence resulting in someone's death, but many of them are also widely criticized for the way they talk to and treat patients in their care. And this has not gone unnoticed by Public Health Minister Dr. George Norton. He got on board the critical wagon while addressing reporters' questions at his most recent press conference.
I'm ashamed to hear when patients complain about what phrases are being used towards them by healthcare givers. And I don't want to say nurses.
Dr. Norton explained that he does not want to limit his criticisms to nurses alone, since these verbal atrocities are also being committed by fully trained doctors within the public health system, something that Norton sees as being intolerable.
I find it totally unacceptable for a doctor to say to a mother who lost a child that you're not the first and you wouldn't be the last to have such a situation.
Back in 2014, there were reports of an 86-year-old woman from Berbice who claimed to have been assaulted by nurses at the Fort Wellington Hospital. Relatives of Julia Melville told a local newspaper following the woman's death that during her final days, the hypertensive elderly complained of being beaten and ill-treated by nurses at that Berbice institution. The woman's loved ones were also quoted as saying that she was taken off saline for no apparent reason, and her face would often be swollen, while her hands bled from what appeared to be lacerations. After a few days, Melville died, and despite many calls, a thorough investigation was never done. But new years and new governments bring new promises, like this one made by Dr. Norton.
Those are things that we're going to investigate, and we're going to take measures to try to eliminate this at all times. It is happening for too long, and it is time we put an end to it. And we're going to do everything in our power to make certain that professionalism is exhibited at all levels of the health institution, regardless of where it is.